Where we separate the fact from the fiction and get to the bottom of a lot of issues that are out there. And we're going to talk with San Antonio Mayor Ron Nirenberg, as we do most Wednesdays. Mr. Mayor, thank you for joining us. Where are we at today when it comes to fighting COVID-19 and being vaccinated with, when we talk about population numbers in San Antonio and Bexar County?
Sure. Well, the number that most people have been hearing for a while has been the eligible population that's vaccinated. And that's the number that you hear has been at 70%, now at 80% with one dose. And then the eligible population that's been fully vaccinated is getting close to 70% now. That's a good number, and we're making progress. But the important number is where we are with total population. Again, everyone under 12 is not yet eligible to receive the vaccine. And then we have folks who are just holding out. And so when you look at the total population that has been vaccinated, it's closer to 55%, which tells you that we have a long way to go to reach herd immunity. So we, again, need to have everybody who is eligible go get vaccinated so that when the eligibility opens up to others, which we hope it will soon, we'll be ready to go. We still have a long ways to go with vaccinations.
Mayor, I want to ask you about a tweet that you put out earlier this afternoon. It caught my attention. I'm going to read it here. It says, San Antonio COVID horror stories aren't coming from the over 1 million folks who are fully vaccinated. The worst tales come from residents attempting dangerous home remedies, exhausted healthcare workers, and our unvaccinated neighbors in the hospital. Get fully vaxxed, please. It's the dangerous home remedies that definitely caught my eye. Tell me what prompted that tweet.
Sure. You've been hearing the stories about self-medication, the use of veterinary medications, anti-parasitic drugs to treat COVID. And those are simply not part of the doctor's regimen. First of all, to prevent getting infected in the first place, we need to be doing the non-medical therapies, and that includes wearing a mask. But we also know now if you're eligible, you need to get vaccinated. But if you do get sick and you are infected with COVID, you need to be under a doctor's care, not going to the website or the back of the magazine and finding out the latest fad. Certainly not on social media. There are trusted medical professionals in our community. They are licensed to treat disease and illness, and COVID is among them. And so it's very important if someone is ill with COVID that they get the proper care and not try to self-medicate. That's why you've seen the FDA put out messages about ivermectin and the use of veterinary medicines that has become part of the fad that's putting people into poison control centers and ending up with a lot of people in the hospital. Please don't self-medicate. Get a doctor's care, but better than that, do what you need to do to prevent getting COVID in the first place.
How frustrating is the misinformation that's out there? I mean, we live in an era where social media is out there and you can't always trust everything that you read or you see. You need to go to trusted sources. But especially when it comes to the coronavirus and COVID-19, how frustrating for you is the misinformation that's out there?
It's beyond frustrating, Steve. It's deadly and it's sad. We are losing people in our community and across this country due to malicious use of social media and other ways of communicating disinformation. And, there is a strong anti-vaccine lobby. It's political. It's got political action committees behind it. And its intent is to keep people from using these medications that have been tested, have been developed by the best medical professionals in the world, and can save lives. And the disinformation campaigns that have run rampant, even in our own community, are costing lives. They are costing us our loved ones, and it is just sad. It's not just frustrating. It's sad, and we're going to look back on this as one of the devastating impacts of misinformation of our day is that we've lost loved ones because of it.
You know, perhaps one of the few silver linings there has been over the last year and a half with the pandemic, the increased focus on mental health. It's certainly a part of a lot more conversations than prior to COVID hitting. And I know that the city budget that the council is expected to vote on in the coming weeks, mental health playing a much bigger role in that budget as well. Can you talk about some of the ways the city plans to use funds to improve mental health in our community?
Yes, and mental health and the treatment of mental health, proper treatment of mental health is part of our long-term Metro Health strategic plan. So we are resourcing that department so that we can not only understand the many facets of mental health illness in our own community, but we can also treat it. Keep in mind, mental health treatment is also a collaboration with the county, who has the Center for Healthcare Services and other facets of our healthcare delivery system. But mental health has become an extraordinary challenge throughout our state and throughout our country. Before the pandemic, it's only become exacerbated because of the pandemic. Some of the innovative things that we're doing right now, we know that there are mental health disturbances that result in emergency calls. And so we've created some cross-disciplinary teams, and we'll be piloting team approaches to emergency response. And so very soon in certain parts of the community, you'll be able to, when there is an emergency call to 911, there'll be an additional option where someone can select a mental health emergency. And the response to that will be a multidisciplinary team that includes a mental health professional, so that we can have appropriate responses to emergency episodes that include mental health on the part of a loved one or someone in the community.
Yeah, mental health also a big part of the homeless issue that we're talking about
Absolutely.
with the city. So I appreciate your time, Mr. Mayor. We've run out of it. I want to talk more about this mental health as it pertains to different parts of our community. Maybe we can do that next week.
Absolutely. Important root cause, and happy to talk about it. Thank you guys so much.
Thank you. We'll be right back.